If you have epilepsy, there's a good chance that you're taking valproic acid, aka valproate, as it is the most widely prescribed anti-seizure medication worldwide. It's also helpful in managing migraines and bipolar disorders. More on that later. Valproic acid's unusual history begins way back in 1882 when it was serendipitously used as an organic solvent to help dissolve other anti-seizure drugs into liquid form. And it was only by pure accident in 1963 that the use as an anticonvulsant was discovered. Talk about luck. Valproate can be administered intravenously or by mouth, in syrup or tablet form, and is helpful in treating seizures such as absence, partial, and generalized seizures. That is a quiz hint. Common side effects include, but not limited to, dizziness, nausea, vomiting, sleepiness, and dry mouth. Serious side effects can include liver complications or failure, pancreatitis, and can increase suicidal risk. Now, this obviously isn't a medical advice channel, but typically it's strongly recommended to avoid valproate if you are living with any of these risk factors. Feel free to pause the video here so you can get a good grasp on this contraindications list. Brand names. Brand names for valproic acid are Depakote, Depakote, and Stavzer. Mechanism of action. The way a drug interacts with our body to stop seizures or regulate mood is called the mechanism of action, and valproic acid's mechanism of action is still unclear. However, most researchers agree that this is most likely a GABA enhancer. Let me explain. In our last video on Topamax, we went over how a neurotransmitter called GABA opens up receptors on the neuron and allows chloride to pass through those receptors. When chloride passes through those receptors, it stops the electrical activity. Well, unfortunately for GABA, there's an enzyme called GABAT. That's GABA with a T if you couldn't tell. And GABAT is kind of a bully to GABA. Now, this is what GABAT actually looks like. And GABAT breaks down GABA every time it comes into contact with it. And with less GABA, the receptors stay closed and chloride isn't allowed to flow through. With chloride unable to flow through, that allows electrical activity to pass through. Okay, we're almost done. When valproate is taken, it binds to those little bully enzymes and blocks them from picking on GABA. That allows GABA to keep the receptors open and allows chloride to pass through more frequently, therefore reducing electrical signals. And that's how valproic acid helps reduce seizures and manage bipolar disorders.
All right, everyone, it's quiz time.
Now that we know valproate is used to treat absence, partial, and generalized seizures, what category of medications does that put it in? A, broad spectrum drugs, or B, narrow spectrum drugs? Answer in the comments below. Hey everyone, want to learn more? Check out this video on how valproate helps people with Lennox-Gastaut syndrome.